Well, I'll as far as
Or do we put together one?
okay, as far as directing patients to information, I don't have a specific list of places for patients to go to that says these are the facts. This is the absolute best information. What I instead do is I open a dialogue with them and say, there's a lot of good information on the internet, but there's also a lot of falsehoods. And I think that one of the things I encourage them to do is take with a grain of salt chat rooms, because these are generally people who are not scientists or physicians. They're generally patients and their opinions, and it's human nature to um, take somebody else's experience and say that's going to apply to me. And I always caution patients that when people say have certain opinions about what happened to them or discuss their own experiences, that does not necessarily apply to you. And the overall thing is that I always say to them, come to me with anything that you've learned about, heard about, were told about, and let's have a discussion with this. Any question that you ask is fair game, and anything that you want to clarify, is this true? What do you think about this? Is this important? I'll be happy to answer that. Rather than say, don't go to these other places. Here are the 3 or 4 places that you should go to and nowhere else. I don't find that to be particularly helpful. And I find that patients and their caregivers end up looking where they want to anyways. With regards to second opinions, I very much encourage second opinions because as part of establishing trust, number one, the patient has to feel like I'm giving them the best advice. So if they go to get a second opinion and it gets verified that what I told them is what they would do, that gives them even more confidence that, okay, he knows what he's talking about. But particularly for neuro-oncology, which I think is unique among other specialties, is that rather than there being competition, there's a lot more collaboration and network. And when you're talking about the standard of care for some brain tumors, regardless of where they go, anywhere in the world, it will be the same. But when it comes to a second opinion about clinical trials, particularly, that is where the encouragement of clinical trials, the encouragement of second opinion is strong. If I don't have a trial that they're interested in, that they're willing to travel to somewhere else to get that, my belief is that they should look for that. So if they said, "Oh, we read about a trial that we're very interested in, and do you have that trial?" And if I say no, and they say, "But there's another place that does nearby, and we would like to," I will absolutely refer them because I want them to feel like they are getting the care that makes the most sense to them. I am still involved. I am still going to follow them, even if they go to another center to enroll in a clinical trial. I will still follow them as well, so they don't feel like I have abandoned them and said, okay, if you're going to go to trial somewhere else, then they're going to be your doctors. I want to work with them, and I want to foster that collaborative spirit. And I think that I have no problems contacting a fellow neuro-oncologist at any time to say, do you have this trial? Is it open? Can I send a patient to you? And vice versa. And I think that second opinions are, particularly in the context of clinical trials, absolutely welcome.